Many strokes happen while you're sleeping, and you won't know it until it's too late. It's one of the most terrifying truths in medicine. You go to bed feeling fine, and wake up unable to speak, move, or even open your eyes. Or worse, you don't wake up at all. I'm Dr. Jonathan Myers. After more than 30 years treating stroke survivors, I've learned that the hours between midnight and sunrise are some of the most dangerous, especially for people over the age of 50 with high blood pressure, diabetes, or sleep issues. But here's the good news: you can take back control. In this video, I'll show you how to sleep in a way that protects your brain, improves circulation, and lowers your stroke risk every night, starting tonight. Because the most powerful stroke prevention doesn't happen in the hospital. It happens in your bedroom while you sleep. Nighttime is when your body slows down, but certain stroke risks speed up. While you sleep, your blood pressure naturally dips, and if it drops too low, it can reduce blood flow to the brain. On the other hand, poor sleep quality, or sleep apnea, can cause sudden blood pressure spikes, irregular heart rhythms, and even oxygen deprivation, all of which can trigger a stroke. Dehydration overnight thickens your blood, increasing the chance of clot formation. And if you sleep in a poor position, it may restrict circulation or compress key blood vessels in the neck. The hours between midnight and 6 a.m. are especially dangerous for older adults and those with existing risk factors. That's why how you prepare for sleep and how you sleep can make all the difference. If you want to protect your brain from stroke, your nighttime routine is just as important as your diet or medication. What you do in the final hour before bed can set the stage for either restful brain-healing sleep or dangerous overnight conditions that increase stroke risk. Let's look at 4 powerful nighttime habits you can start today to guard your brain while you sleep. 1. Don't eat too late. Eating a large meal close to bedtime can disrupt your body's natural rhythms in ways most people don't realize. When you eat late, especially heavy or high-fat foods, your body stays in digestion mode instead of shifting into rest and repair mode. This keeps your heart rate elevated, increases nighttime blood pressure, and can even cause acid reflux, which interrupts deep sleep. But here's the part connected to stroke. Late-night eating is often linked with higher blood sugar and insulin levels overnight, leading to inflammation and oxidative stress in your blood vessels. Over time, this raises your risk of clot formation and arterial damage. The fix: eat your last full meal at least 2 to 3 hours before bedtime. If you need a light snack later, choose something low in sugar and easy to digest, like a banana plain yogurt or a handful of almonds. Avoid spicy, salty, or greasy foods. Your brain needs your body fully at rest, not digesting during the night. 2. Keep your hands and feet warm. It might seem unrelated, but cold extremities, especially cold feet, can trigger a vascular stress response in your body. When your hands and feet are cold, your blood vessels constrict, making it harder for blood to circulate evenly. For people already at risk of stroke, this can raise nighttime blood pressure and reduce cerebral circulation. In fact, studies show that sleeping in a slightly cooler room but with warm feet leads to deeper, more restorative sleep, lower sympathetic nervous system activity, and better overnight blood flow. Before bed, soak your feet in warm water. For 5 minutes, wear socks if your room is cold, and use a blanket that keeps your body comfortably warm but not overheated. Avoid sleeping with icy toes. It's not just about comfort, it's about circulation. 3. Sleep in the right position. Your sleep position affects far more than just comfort. It can influence blood flow, airway function, and pressure on key arteries. Some positions can even make sleep apnea worse, a major underdiagnosed contributor to nighttime strokes. So what's the safest sleep position for brain health? Best sleeping on your side, especially the left side, helps gravity support better blood flow back to the heart and reduces pressure on major veins. It also supports lymphatic drainage, which is how your brain clears waste at night. Avoid sleeping on your stomach can strain the neck, compress carotid arteries, and increase intracranial pressure. Over time, this may limit circulation and oxygen delivery to the brain. Back sleeping is okay for some, but not for those with sleep apnea or heavy snoring. It can worsen breathing problems and oxygen drops during sleep. If you're not used to side sleeping, try placing a pillow between your knees and using a body pillow for support. Over time, your body will adapt. 4. Turn off electronics. Protect your melatonin and arteries. This is the habit most people ignore, but it could be one of the most powerful turning off screens at least 30 to 60 minutes before bed. Why? Because your phone, TV, and tablet emit blue light, which suppresses your body's production of melatonin, the hormone that signals your body it's time to sleep. Melatonin does more than just help you fall asleep. It also plays a protective role in brain and blood vessel health. Low melatonin levels are associated with higher nighttime blood pressure, reduced vascular repair, and increased inflammation. In fact, people with chronic insomnia or poor sleep quality tend to have higher stroke risk, even if they are otherwise healthy. What can you do? Set a tech curfew 45 minutes before sleep. Dim lights in your room. Read a paper book stretched gently, or listen to calming music or white noise. If you must use a screen, install a blue light filter app or use night mode. Protecting your sleep hormones protects your circulation, and that protects your brain. Final note on consistency. None of these habits work overnight, but practiced consistently, they help regulate your nervous system, support healthy blood pressure, and ensure that your brain gets the oxygen and nutrients it needs while you rest. Think of your nighttime routine like locking the doors to your house. You don't wait until something bad happens to take it seriously. You do it every night as a habit to stay safe. Your brain deserves that same protection. Let's move on to something just as important, the best sleep positions to support healthy brain circulation and prevent silent danger in the night. Your sleep position might not seem important, but it can make a significant difference in how well your brain is supplied with oxygen and blood throughout the night. Poor circulation while sleeping is a hidden risk factor for stroke, especially as we age. Let's start with the best position sleeping on your side, specifically the left side. This position supports better venous return to the heart, meaning your blood flows more efficiently back to the heart and lungs for oxygenation. It also relieves pressure on the inferior vena cava, a large vein that runs along the right side of your spine, allowing smoother circulation. Sleeping on your side also enhances glymphatic clearance, which is how your brain flushes out toxins and waste during deep sleep. Think of it as your brain's night shift cleaning crew. It works best when you're on your side. For stroke prevention, this cleansing process is especially important as the buildup of certain proteins and waste products has been linked to vascular inflammation and small vessel disease. Now, what about the positions to avoid? Sleeping on your stomach is the worst option. It puts unnatural pressure on your neck and spinal cord and can partially compress your carotid arteries, the major blood vessels that supply blood to your brain. It also forces you to turn your head to one side all night, restricting blood flow and creating tension in the cervical spine. Sleeping flat on your back is acceptable for some people, but it can be risky if you have sleep apnea or tend to snore. In these cases, your airway can collapse during sleep, reducing oxygen to your brain and causing sharp fluctuations in blood pressure, both strong contributors to nighttime stroke risk. If you prefer sleeping on your back, elevate your head slightly using a supportive pillow. This helps keep your airway open and reduces pooling of fluids in the upper body. In short, your safest bet is side sleeping with a comfortable pillow that keeps your spine aligned. It's a small adjustment with major benefits, and your brain will thank you for it night after night. How do you know if your sleep habits are putting you at risk for stroke? The signs are often subtle, easy to dismiss or blame on age, stress, or a bad mattress. But when these symptoms happen consistently, they may point to unsafe sleep patterns that affect your brain's health and circulation. Here are some red flags you shouldn't ignore. 1. Waking up tired or groggy, despite 7 to 8 hours of sleep. This could mean your brain isn't reaching deep restorative sleep stages or that your oxygen levels are dropping during the night. Poor sleep quality can increase inflammation, impair blood vessel repair, and raise morning blood pressure, all of which contribute to stroke risk. 2. Loud snoring or gasping for air while sleeping. If your partner says you snore loudly, stop breathing for moments or gasp during the night. you may have sleep apnea. This condition causes repeated drops in oxygen levels and spikes in blood pressure, especially dangerous for the brain. Sleep apnea is one of the most underdiagnosed stroke risk factors in older adults. 3. Waking up with a dry mouth or headache. These may be signs that your airway is partially blocked while sleeping, or that you're breathing through your mouth due to nasal congestion or sleep apnea. Both symptoms can reflect poor oxygenation at night. 4. Frequent nighttime urination. Nocturia. Needing to get up more than once or twice to urinate at night can disrupt deep sleep and may be linked to poor heart or kidney function. It also leads to fragmented sleep, which increases stress hormones and blood pressure by morning. 5. Irregular heartbeat or palpitations at night. If you feel fluttering or skipping beats while lying in bed, it may signal atrial fibrillation, a common but silent cause of stroke. Many cases of nighttime strokes are triggered by unrecognized irregular rhythms during sleep. If you experience any of these signs regularly, don't ignore them. Talk to your doctor. A simple sleep study or overnight blood pressure monitor can reveal hidden risks. Remember, safe sleep is quiet, deep, and restorative. If your nights feel anything less, it's time to act. Your brain depends on it. You spend a third of your life sleeping, but that time is not passive. It's when your brain heals, your blood pressure resets, and your circulation shifts. The way you prepare for bed, the position you sleep in, and the quality of your rest can all mean the difference between a healthy morning and a life-altering stroke. As a doctor who's treated thousands of stroke patients, I can tell you this prevention starts at home, and it starts at night. Don't wait for symptoms. Protect your brain before anything happens. If this video helped you, please like, subscribe, and share it with someone you care about. You never know whose life you might be saving. Thank you for watching. Sleep well, sleep smart, and take care of that incredible brain of yours tonight and every night.